One of the big worries is that folks would forego routine care because of fear of COVID.
Did you skip going to the doctor over the last year? Understandable, but sometimes dangerous, and now our healthcare workers are dealing with it. Good evening, everybody. I'm Brian Mudd.
I'm Lauren Motter. Right now, 24 people are in the Lubbock hospital with coronavirus. That's a drastic change from late November when doctors and nurses were treating more than 300 people with the virus. Today, 11 people testing positive, and sadly, 2 more people have died.
But there's not much of a break for our healthcare workers because more and more folks are now showing up in hospitals with problems that were likely ignored during the height of the pandemic. KAMC's Amy Koczera joins us live from UMC tonight to talk about this latest strain on our healthcare teams.
Yeah, Lauren, Brian, while it's great to see those numbers falling, our hospitals are now seeing more patients with other illnesses. And it's up to us to continue taking those precautions so they can keep helping those patients.
It's been wonderful. Folks are very excited.
Healthcare workers are glad there are fewer patients battling coronavirus in the hospital, but there are still plenty of patients suffering from all kinds of different health issues.
For this time of year, we continue to be very busy with more patients than beds still.
Dr. Reagan believes the increase of patients with other illnesses is due to people not visiting doctors for their annual checkups during the last year.
Some of that is pent-up demand from all the trouble of getting into healthcare, people not coming to the hospital or to the doctor and letting their illnesses go.
The low COVID hospital rate allows our doctors and nurses to continue providing care, so we need to keep it that way.
Make no mistake, the data is clear that masks help reduce the spread of not only COVID, but other viruses like the flu.
And with Lubbock being a massive medical hub, Dr. Reagan says it's crucial they don't get overwhelmed with another coronavirus breakout.
It's a very large service area. When our hospitals get congested with patients, it limits the ability to help those patients out in the region as well as here locally.
Although Governor Abbott has lifted the mask mandate, Dr. Reagan is urging everyone to still practice those safety protocols.
To help us keep the hospitals open and freely working with plenty of capacity to handle all the patients that come in, wearing a mask, washing your hands, and being smart about the situations you put yourself in.
And with a lot of unknowns surrounding new variants, Dr. Reagan tells us it's crucial the public continue getting vaccinated, wearing masks, and practicing social distancing so our healthcare systems don't get overwhelmed. Live at UMC, I'm Amy Koczera, KAMC News.